A hospital reports that a batch of injectable antibiotics contains visible glass particles. What classification of recall should DRAP apply? A. Class 1, B. Class 2, C. Class 3, D. Class 4. Answer: A. Class 1. Explanation. Class 1 recalls apply to life-threatening risks like visible foreign particles and sterile injectables. Q2. Class 2 recall. A company discovers that labels of its antihypertensive tablets miss the storage conditions, but the medicine itself is safe. Which recall classification applies? A. Class 1, B. Class 2, C. Class 3, D. Class 4. Answer: Class 2. Explanation. Mislabeling or missing information with potential for medically reversible harm is Class 2. HAS-S3 recall. A vitamin syrup batch is found to have expiry date missing on label, but no health risk exists. Which recall classification applies? A. Class 1, B. Class 2, C. Class 3, D. Class 4. Answer: C. Class 3. Explanation. Defects unlikely to cause harm but violating labeling specifications, e.g. missing batch no expiry, are Class 3 recalls. Track Q4. CLIN in use. A cosmetic cream has a minor printing error on its carton, font size issue, with no impact on safety or efficacy. What should DRAP issue? A. Class 2 recall. B. Class 4 caution in use. Notice C. Statutory recall. D. Immediate ban. Answer: B. Class 4 caution in use notice. Explanation. Class 4 notices are issued for minor defects where no health threat exists but caution is advised. Q5. Timeline for LL. A company receives a statutory recall notice for a contaminated injectable. Within how long must physical recall be completed? A. 48 hours, B. 7 days, C. 21 days, D. 30 days. Answer: B. 7 days. Explanation. Class 1 recalls must be initiated within 48 hours and physically completed within 7 days. Q6. Levels of recall. A phoamine syrup was distributed up to hospital pharmacies and clinics. What is the depth of recall required? A. Consumer level. B. Retail level. C. Wholesale level. D. Manufacturer only. Answer: B. Retail level. Explanation. Retail level recall applies when defective products have reached pharmacies, hospitals, or clinics, but not individual patients yet. Q7. Voluntary versus statutory recall. A C finds cross-contamination in its tablet line during an internal QA audit and initiates recall. This is an example of A. Statutory recall, B. Voluntary recall, C. International recall, D. Caution in use. Answer: B. Voluntary recall. Explanation. Voluntary recall is initiated by the manufacturer when they detect a defect themselves. Q8. Statutory recall. A provincial drug testing LNs microbial contamination in a paracetamol suspension and informs DRAP. Which type of recall will DRAP initiate? A. Voluntary recall. B. Statutory recall. C. Caution notice. D. No recall needed. Answer: B. Statutory recall. Explanation. Statutory recall is ordered by DRAP or provincial government based on lab reports or violations. Q9. Communication method. A life-saving injectable is recall contamination. Which communication methods must be used? A. Recall letter only. B. Press release plus recall letter. C. Caution in use, notice only. D. Internal memo only. Answer: B. Press release plus recall letter. Explanation. For Class 1 recalls, communication requires recall letters and often press releases to alert public and HCPs. Q10. Final recall closure. After completing a recall, a company submits TS. Who officially closes the recall after verifying effectiveness? A. The licensee, manufacturer. B. Provincial Drug Control Department. C. Action Group on Recall of SF Products. D. QA Division of DRAP. Answer: D. QA Division of DRAP. Explanation. Recall closure is issued in writing by DRAP's QA division after confirming effectiveness.